Cells and tissues. Cells and tissues. Cells are the basic structural building blocks of the human body. There are many different types of cells, for example, muscle, nerve, and blood. These minute cells can only be viewed using a microscope and contain three main structures: cell membrane, nucleus and cytoplasm. Within the cytoplasm are different structures that are referred to collectively as organelles. A tissue is a group of cells that perform a specific function. The basic types of tissues in the human body include epithelial, muscle, nervous, and connective tissues. Epithelial tissue covers the outer body surfaces of the internal organs, forms glands and lines the internal body cavities. The cells have a simple shape and fit closely together and may be a single layer as in simple epithelium or several layers as with compound or stratified epithelium. Their functions include movement of materials in/out or around the body, protection and secretion. There are 6 classifications of epithelial tissue which are classified according to their shape. One. Squamous epithelium, flat, scale-like cells that form the walls of the blood capillaries, epidermis, lining of the mouth cavity and air sacs of the lungs. 2. Cuboidal epithelium, cube-shaped cells that are found in the lining of the sweat glands, kidney tubules and thyroid gland. 3. Columnar epithelium, elongated cells that line the stomach, intestines and urinary ducts. 4. Ciliated columnar epithelium, elongated cells that cover wet surfaces and are interspersed with goblet cells that secrete mucus. The hair-like cilia help to move particles along, and it is found in the air passages where it helps to filter the air breathed in. 5. Compound transitional epithelium, several layers of cells when relaxed but only 1/2 layers when stretched. Therefore found in areas where the tissue needs to stretch such as the bladder wall. 6. Glandular epithelium, simple or compound cells that secrete necessary chemicals and are found in the glands such as sweat glands, sebaceous glands, mammary glands and salivary glands. Connective tissue connects, fills in spaces, supports and binds all other types of tissue. Inside the connective tissues are living cells, as well as the matrix, collagen and elastin fibers, which are all non-living structures. The collagen fibers are produced by fibroblasts and are required to provide a supporting fibrous framework. The elastin fibers allow areas of the body to stretch as they have elastic qualities. The connective tissue usually has a rich blood supply and cells that are not tightly packed together. There are 5 types of connective tissue. 1. Loose connective tissue or areolar tissue, smooth and moist tissue that has a loose network of collagen and elastin fibers, few blood/nerve cells, however some fat cells. It forms a tough transparent lining in between the organs and attaches the skin to the underlying muscles. 2. Adipose tissue, loose connective tissue that contains a network of fat cells that provide energy reserves and insulation for the body. It also protects the delicate organs. It can be found in the subcutaneous layer of the skin, around the heart and kidneys. 3. Dense connective tissue, contains bundles of strong collagen fibers and fibroblasts. It is very tough and looks silvery to white in color. It can be found in the tendons, ligaments and fascia surrounding the muscles. 4. Cartilage. This is a tough, elastic tissue that contains cells called chondrocytes and is separated by fibers. This tissue does not have a blood supply and is located in between the vertebrae where it forms the intervertebral discs. 5. Bone tissue, basically a specialized type of cartilage which has undergone ossification. IT has collagen fibers to provide strength, mineral salts provide rigidity, and a rich blood supply to provide nutrients. It is the tissue that makes up the human skeleton. Thanks for watching.